Hi, I'm Art Kaplan. I'm at the Division of Medical Ethics at NYU School of Medicine. Medscape recently conducted a poll of more than 5,000 physicians on a subject that, no matter your politics, no matter your medical specialty, no matter your educational background, it's love and romance. And this particular survey was trying to figure out, when did physicians feel that it was acceptable to date a patient? And roughly speaking, the answer came back if there'd been a 6-month time period where you hadn't treated the patient. So 6 months lapse in terms of doctor-patient interaction would be, to at least the poll respondents, okay relative to romantic interaction or efforts at romance. Well, I think that is a little bit of a surprise. It's probably a little different from what we might have seen years ago, my hunch being that more physicians might have said it's okay to date a patient. But given the Me Too movement, given concerns about lawsuits, given concerns about misunderstanding when someone is in a doctor-patient relationship, even given a little bit of the weakening of the doctor's prerogative to kind of act as they wish, engage as they wish with a patient from 50 or 60 years ago, I think we're seeing a change in mores, and we now see more doctors saying either don't do it at all, or you have to have an interval before you could have some kind of a effort at a relationship. Now, I happen to think that that 6-month standard, while completely arbitrary, completely random, is not grounded in any social science, makes some common sense. Again, it's important to keep in mind, if you're treating someone who you're thinking about dating, or you are dating, or for that matter, who is a family member, unless it's a minor kind of treatment, you don't want to be doing that. It either distorts your ability to objectively assess a health problem in a person. If they're your wife, if they're your longtime girlfriend, better to have someone else treat them if that's possible. Or if you're thinking about going out with someone, better to say, look, I'd like to have a chance at a romantic relationship, but maybe we need to look into getting you someone else to give you your care. It is well established that romance, strong emotional feelings, can distort judgment, and they can get in the way of providing both the best diagnosis and the best possible care, and even nagging the patient to comply and do what they ought to be doing if they're going to take on their particular illness or disease. So I think there still should be a break between seeing a person and deciding that that's somebody you might want to have a romantic relationship with. 6 months makes sense to me. It just seems intuitively long enough, but not that long. Somebody for sure is going to say to me, but if I just took a mole off somebody, you tell me I have to wait 6 months before I can ask them out? Well, I would say, look, some of this is case by case. There are minor medical interactions where you're not going to likely see the person again in the next week, 2 weeks, much less 6 months, because they came in for something trivial. Maybe there you could make the case that you wouldn't have to wait as long. But the general rule is, in a serious medical relationship, don't have a romantic interaction or a strong emotional connection, family member, or even close personal friend, with the patient. Try, if it's possible, to have someone else deliver the care. I know it isn't always possible. There are specialties where there's no one else around for hundreds of miles. There are situations where there are no doctors around except a rural practitioner. I get all that. So I understand how we may have to use common sense. But common sense also says, ethically and practically, don't get involved with someone you're trying to care for. It's bad medicine. I'm Art Kaplan from the Division of Medical Ethics at NYU Langone. Thanks for watching.